The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, it is great seeing you.
It's great seeing you. The audience can always tell when we've had a private joke before we come on because our smiles are much bigger.
I wasn't going to say anything, but you did it. You gave away our secret. So,
That's right.
yeah, we were having a chuckle. We were having a chuckle before we started talking here.
Yeah.
So, Dr. Chapman, thank you again for being with us. And today we're going to talk about as we go into these winter months. I know my skin is already starting to feel drier, more tight because I've had to kick on the heat a couple of nights here and there. So you're going to have some advice on how to deal with that.
So we have an amazing new treatment for skin hydration. And, the number one thing we see when patients are coming in is dehydrated skin. I mean, that's what you see. You see the crepiness, you see the dryness. And some people really struggle with excessive dry skin on their face, sometimes to it being the point of pathology. Sometimes topicals do not do what they need to do to truly moisturize, and you
Mm-hmm.
have to understand where the topical is targeted to work. So if the target is just the epidermis, then you're not going to get that much moisturization truly deeply into the tissue and really change the appearance of the skin. It'll be temporary. But we have a couple of things that go deeper into the tissue. And one I want to talk about today is Skinvive by Juvederm. It is one of the most unique products that we have now to hydrate the tissue. Basically, it is an injectable that is indicated currently in the United States for cheek area. Off
Mm-hmm.
label in my practice, I use it above the lip and also the chin and the neck. It is a phenomenal product because it increases a downregulated protein as we age. So we have this protein called aquaporin 3 in our tissue. As we begin to age, that protein begins to downregulate. What that protein is responsible for is bringing water and glycerol into the dermis and out of the dermal area. So as aquaporin 3 drops, the skin dehydrates more
Mm-hmm.
easily, and we get that crepey, sallow looking skin. When we inject Skinvive, which is a hyaluronic acid at 12 milligrams per ml, what we get is a super upregulation of aquaporin 3, and we get this nice glowing tissue within 3 to 4 weeks. So, for those who struggle from topicals not working the best, by injecting small amounts of this into the dermal tissue, we see a radiance and glow as early as 2 weeks, but definitely at 4. The second thing we have that's new and that we love, it's a topical. It's called HA5 Hydra Collagen Replenish and Restore. This product is an improvement upon our HA5 hyaluronic acid product from Skin Medica. And it basically has twice the amount of hyaluronic acid. It has the ability through the Vitassense technology of the product to target the dermal epidermal junction and also stimulate certain types of collagen to become more prominent in the tissue. So it traps moisture by fortifying the dermal epidermal border. That's that
Mm-hmm.
area between the outer layer of the skin and the second layer of the skin where all the moisture should be kept. And then it also stimulates cells to make more collagen. So we're also increasing that product, which makes the skin look plump. So we have this dual way of hydrating, plus the now double hyaluronic acid that's in it. So you get a hydration that lasts up to 48 hours, whereas before it lasted up to 24. So a great improvement on an already wonderful product. I've personally been using this product for about 8 weeks now and absolutely love what it is doing for my skin. I have received multiple compliments in the office. People do see a difference. It is quite amazing. One last thing about the HA5 hydrocollagen replenish and restore is that the use of this product, in 12 weeks, people noticed in the study that their skin looked 3 to 6 years younger appearing
Wow.
when they applied it twice daily. And of course, as we mentioned last week, Diamond Glow is definite as well because you want to exfoliate that external dead epidermal cells, which build up and make the tissue look dry. That also causes the tissue to break out at times because it traps oil underneath that dead skin. So the Diamond Glow really helps to keep the pores breathing, cleaned out, and allows for us to infuse those good products deeper into the tissue.
That sounds like a combination of all three things we've talked about could really be a miracle worker.
Absolutely. If you battle dry skin, we can fix it.
All right. Well, Dr. Chapman, great to know, and we appreciate you coming on and talking about it.
Thank you for having us today.